Welcome to another deep dive. We got a really interesting one today about CBT.
CBT.
That's right, cognitive behavioral therapy. And I bet you're thinking, what does therapy have to do with nursing?
Right.
Well, a lot, actually. We got this huge stack of material from a listener who asked us to kind of dig through this and pull out the most interesting parts about CBT, and especially how CBT can be relevant to nursing.
Yeah.
And that's where you come in.
Okay.
So first of all, for those of you who might not be super familiar with CBT, what is it exactly?
So CBT, it's basically a type of therapy that helps people change their thoughts, feelings, and behaviors.
Okay.
And it's very structured and goal-oriented, so it's not just like sitting around and talking about your feelings.
Right.
There's a real plan and steps involved.
So it's kind of like nursing in a way, right?
Yeah, exactly.
We assess, we intervene, we try to guide patients. It's just that in CBT that the focus is on the connection between thoughts, feelings, and behaviors.
Yeah, I mean, think about it.
Okay.
You're always, checking someone's vital signs,
Right.
Temperature, blood pressure, all that.
Yeah.
Well, in CBT, we're assessing mental vital signs, so to
Oh,
speak.
oh, I like that.
Yeah, so we're looking at their thought patterns, how those are influencing their well-being.
So instead of checking their temperature, we're checking their thought patterns.
Exactly.
All right.
And how those might be, impacting their mental health.
Got it.
So let's say, for example, a patient's really anxious about an upcoming procedure.
Okay.
A CBT therapist would want to understand what are their thoughts about this procedure. Are they catastrophizing? Are they focusing on the worst case scenario?
Right.
And then how are those thoughts making them feel? Are they overwhelmed? Are they panicked?
Uh-huh.
And then finally, how are those thoughts and feelings impacting their behavior? Are they avoiding information about the procedure? Are they having trouble sleeping?
Oh, so you really break it down into those three things.
Yeah.
Thoughts, feelings, and behaviors.
Yeah, they're all connected,
Yeah.
And they all influence each other.
It's like a domino effect, I imagine.
Yeah, exactly.
Like if you have those negative thoughts, that triggers those anxious feelings, which then lead to behaviors that might actually make things worse, like not getting enough sleep or being even more stressed.
Exactly.
So with CBT, we're trying to kind of break that chain.
Yeah, the goal is to break those unhealthy patterns
Okay.
and replace them with healthier ones.
So it's similar to how nursing interventions try to improve physical health, but CBT interventions are all about improving mental health
Right.
by changing those thought and behavior patterns.
Exactly. So, for example, a nurse might teach relaxation techniques to help a patient manage their anxiety.
Right.
But a CBT therapist might help that same patient to actually challenge those thoughts.
Those negative thoughts.
Yeah, like those catastrophic thoughts.
Okay.
And help them develop some coping statements instead.
So it's all about equipping people with the tools they need to manage their health.
Exactly.
Both physically and mentally. Okay, 'cause this is all starting to make sense.
Good.
But how does this actually translate into skills that nurses can use?
Right.
Because we're not therapists.
No, you're not doing formal therapy.
Right.
But a lot of the skills used in CBT are actually really applicable to your work.
Okay, so I don't need to go back to school and get another degree.
No. That's
a relief.
Think of it more as like fine-tuning those communication and problem-solving skills you already have.
Okay, so I'm already using some of these things.
Right.
Just maybe not in a formal way.
Exactly.
But how exactly does CBT kind of break these skills down? Is there like a specific framework?
Yeah, so the materials that you sent me, it actually breaks it down into 3 levels.
Okay.
Beginner, intermediate, and advanced.
And that's perfect for us as nurses.
Yeah, I thought you'd like that.
Because we're used to that kind of skill level system.
Exactly.
All right, so walk me through these levels.
Okay.
What kinds of skills are we talking about at each stage?
So let's start with the beginner skills.
Okay.
One of the most important ones is clear communication,
Okay.
which, nurses do all the time.
Constantly explaining procedures, medications, treatment plans.
Exactly. Yeah. And CBT therapists rely on this same skill to, build rapport and make sure the client really understands what's going on.
So it's not just about spitting out information.
No.
It's about really making sure the patient understands what we're doing and why.
Exactly. It's about tailoring your communication to that specific patient.
Right.
Making sure they feel heard, addressing any questions or concerns they might have.
Right, like really taking that time. Okay, so clear communication, that makes sense.
Yeah.
What's another beginner skill?
Another one is goal setting.
Oh, we're good at that as nurses.
Yeah, you guys are pros at that.
Yeah, creating those care plans with all those goals.
Exactly. And CBT basically takes that same idea
Okay.
and applies it to mental and emotional well-being.
Okay, so instead of just focusing on, getting the patient out of bed, we're also thinking about how to help them regain their sense of independence or manage their pain so they can, enjoy life again.
Precisely. It's about, working with the patient
Mm-hmm.
to figure out, what goals are meaningful to them.
Yeah, what matters to them.
Yeah. And then how can we create a plan to work towards those goals together?
Okay, I'm liking these beginner skills.
Good.
What about agenda setting?
Oh, agenda setting.
Is that a CBT skill?
It is. Okay.
And I know you guys are pros at that too.
Well, as a nurse, your day is one big agenda.
I can imagine.
It's constant juggling act.
Well, in CBT, therapists use agenda setting to help make sure the session is structured and focused.
So we're not just like, wandering all over the place.
Right.
We have a plan.
Exactly, and make sure that the therapist and the client are on the same page.
Okay. And that they're using their time together effectively.
So it's kind of like having a roadmap for that conversation.
Yeah.
Making sure you're hitting the most important points and staying on track.
Yeah, exactly.
Sure.
And then the last beginner skill is assigning and reviewing homework.
Homework.
I know it sounds a little weird.
Yeah, we're not in school.
I know, but think about it this way.
Okay.
You're always giving patients instructions.
Right, like taking medication, scheduling follow-up appointments,
Exactly.
following a certain diet.
Yeah, so CBT just takes that idea a step further.
Okay.
And really encourages patients to practice certain skills between sessions.
So it's like recognizing that healing and growth doesn't just happen when you're with a doctor or a nurse. It's about what you're doing at home, too.
Exactly.
Okay, so these beginner skills are kind of the foundation
Right.
for more advanced CBT techniques.
Exactly.
All right, I think we've got the basics down.
Good.
Now I'm kind of curious about those intermediate skills. Okay, what kind of things are we talking about there?
Let's get into that. Okay, so intermediate CBT skills. This is where we really start to see how this can make a difference in patient care.
Okay, gives you an example.
So let's say you have a patient who's recovering from surgery,
Okay.
but they're having a really hard time.
Uh-huh.
They're expressing all these negative thoughts.
Like what?
Like, I'll never get better, or this is too much to handle.
Oh, yeah, we hear those all the time.
Right.
And you can just feel that despair.
Exactly. And it can really hinder their recovery.
Okay.
So this is where CBT can help.
Okay.
Nurses can use techniques like Socratic questioning to help patients challenge those thoughts.
Instead of just, saying, don't worry, you'll be fine.
Yeah, it's not about offering empty reassurances. It's
Right.
about really helping them to examine those thoughts and see if maybe there's a different way of looking at things.
So, like, what kind of questions would you ask?
Well, you could ask things like, what evidence do you have to support that thought? Or is there another way to look at this situation?
So you're not telling them what to think.
No.
You're just helping them to think about it in a different way.
Exactly. You're helping them become aware of their own thought patterns and giving them the power to challenge those thoughts that might be holding them back.
I like that. Giving them the power.
Yeah.
Okay, so that's working with thoughts. What about behaviors?
Yeah, so CBT also emphasizes the link between behavior and mood.
Oh, that makes sense.
Yeah, like even small actions can have a big impact on how we feel. So as nurses, you're already encouraging positive health behaviors.
Right, like taking their meds, getting out of bed,
Exactly.
doing their physical therapy.
And with CBT, we're just taking it a step further.
Okay.
We're helping patients understand that even if they don't feel like doing something, sometimes just going through the motions can actually help them to feel better.
Oh, that's interesting.
Yeah, so even small things.
Like what?
Like getting dressed or having a conversation with a loved one.
Or listening to music.
Exactly. All those things can make a difference.
So it's not just about the big things.
No, it's about those little things too.
The little things add up.
Exactly.
Okay, so we've talked about thoughts, we've talked about behaviors. What about emotions?
Right. Emotions. So this is a big one.
Yeah, as nurses, we're dealing with people's emotions all the time.
All the time.
I mean, fear, anxiety, sadness,
It can be
frustration
really
for
overwhelming.
both the patient and the nurse.
Yeah. And this is where CBT offers some really great tools.
Like what?
Like things like mindfulness and distress tolerance.
Okay.
These can help patients to manage those difficult emotions in a healthier way.
So it's not about trying to, make the emotions go away.
No.
It's about learning to deal with them.
Exactly. It's about giving them the skills to cope.
Okay.
So, for example, you might teach them some simple breathing exercises to calm their anxiety.
Right.
Or you might guide them to focus on the present moment.
Okay.
Instead of dwelling on the past or worrying about the future.
So those mindfulness techniques that we
Yeah.
hear so much about,
Exactly.
these intermediate skills sound really powerful.
They are.
It feels like we're shifting from just managing symptoms
Hmm.
to really empowering patients to
Exact.
take control of their own health.
It's about giving them the tools they need
Yeah,
to actively participate in their own healing.
and that can make such a difference.
It really can.
Okay, so these intermediate skills lay the groundwork
Huh.
for even more advanced techniques.
They do.
Okay, I'm intrigued. What kind of advanced CBT skills can nurses use?
So let's dive into those now. Okay, so advanced CBT skills. These are the ones that can really help you deal with those tricky situations.
Like, what kind of situations are we talking about?
Well, think about those patients who are resistant to treatment,
Oh, yeah. Every nurse knows those patients.
the ones who refuse medication or dismiss your advice.
Or want to do things their own way, even if it's not the safest approach.
Exactly, those are the tough ones.
Yeah, it can be so frustrating.
Right, because you're just trying to help them.
Exactly, but they're not having it,
So instead of getting into a power struggle,
which is so easy to do.
it is.
You want to get your point across,
Right.
and they're pushing back.
Well, with CBT, you can actually learn to understand that resistance.
Okay, so instead of just getting frustrated,
Yeah,
you try to figure out what's behind it,
right. It could be fear, it could be mistrust.
Hmm.
Maybe they just don't understand.
or they feel overwhelmed.
Exactly. There's so many reasons why someone might be resistant.
So how do we use CBT to help with that?
Well, CBT gives you the tools to address that resistance in a more collaborative way.
Okay, so instead of saying you need to do this,
Yeah, that's not going to work.
it's more about saying, help me understand why you're hesitant.
Exactly.
What are your concerns?
You're validating their feelings, you're building trust, and you're working together to find a solution.
I like that, working together.
Yeah, it's a partnership.
Okay, so that's dealing with resistance.
Mm-hmm.
What other advanced skills are there?
Well, another important one is repairing ruptures in the relationship.
Okay, what does that mean?
So imagine a situation where something goes wrong.
Okay, like what?
Maybe there's a miscommunication or a misunderstanding.
Or something happens that creates tension between you and the patient.
Exactly. Those moments can be really awkward.
Yeah, you can feel that trust starting to erode.
And you're not sure how to get things back on track.
Right, and that can really affect the care you're able to provide.
Absolutely. Well, CBT gives you specific techniques to help repair those ruptures.
Okay, like what?
It starts with acknowledging the misstep.
So you're not pretending it didn't happen.
Right, you're facing it head on.
Okay,
And then you take responsibility if necessary.
if you messed up.
Yeah, and you really listen to the patient's perspective.
So it's about rebuilding that bridge of trust.
Exactly, because without trust, it's hard to provide effective care.
That makes sense.
And then the final advanced skill is all about adapting to the situation.
Oh, flexibility. That's a
Yeah.
nurse's best friend.
Right, because no two patients are the same.
And every day is different.
Exactly, and that's where CBT's emphasis on flexibility comes in.
Okay, so we're not fleots.
No.
We have to be able to think on our feet.
Exactly. You have to be able to assess the situation
Mm-hmm.
and adjust your approach accordingly.
It's like that jazz improvisation analogy we were talking about earlier.
It is.
Remember-
you have your basic skills.
But then you have to be able to improvise.
Yeah, you have to listen and respond to what's happening in the moment.
So we're like jazz musicians with a nursing degree.
Exactly. So these advanced skills, they're all about dealing with those complex situations that come up in nursing.
And they require a lot of, practice and experience.
Right? It's not something you learn overnight.
But it's so worth it
It is.
to be able to handle those challenges with confidence and compassion.
Exactly.
Well, this deep dive has been amazing.
I'm glad you think so.
We've learned so much about CBT
Yeah, it's a really fascinating approach.
and how it can be applied to nursing.
And it's not just about using these techniques with our patients.
Right, it's about using them for ourselves too.
Exactly. Remember that idea about becoming our own therapists.
Yeah, we're not just helping our patients.
We're helping ourselves too.
I love that idea.
It's about personal growth and development.
Okay, so as we wrap things up,
Mm-hmm.
I want to leave our listener with a little challenge.
Okay, I like that.
So if you could choose just one CBT skill to focus on this week,
Just one.
what would it be?
That's a great question.
Instead of trying to do everything at once.
Right. Pick one thing and really master it.
Exactly. So what resonates with you the most?
It could be explaining things more clearly,
Or setting goals with your patients?
or maybe using those Socratic questioning techniques.
Ooh, I like those.
Yeah.
They're so powerful.
They are.
Okay, so I'm going to choose Socratic questioning.
Great choice.
Now, how do I actually practice that skill?
Well, you could start by just paying attention to those moments when patients express negative thoughts.
Okay, so when they say things like, I'll never get better.
Exactly. And instead of jumping in with reassurances or solutions, try using those Socratic questions to gently guide them.
To a different perspective.
Exactly. So instead of saying, don't worry, everything will be fine,
Right.
you could ask, what evidence do you have to support that thought?
Or is there another way to look at this situation?
Exactly. You're helping them to explore their own thinking.
Okay, I can do that.
And then afterwards, take some notes.
Okay.
What worked? Well, what could you have done differently?
So I'm constantly learning and improving.
Right. You're turning your everyday work into a learning opportunity.
I like that.
And remember, just like in nursing,
Mhm.
becoming skilled in CBT is an ongoing journey.
It's not a destination.
Exactly. There will be times when you nail it and
Mhm.
times when you don't.
But the important thing is we keep practicing
Yes,
and keep learning.
exactly.
Well, thank you so much for sharing your expertise with us today.
It's been my pleasure.
I feel like we've all learned so much.
Good. I'm glad to hear that.
And to our listener out there,
Yeah.
keep up the amazing work you're doing.
You're making a difference every day.
Yeah. And we're here to support you in your journey.
Yeah.